Hey everybody, Dr. Sarah Allen here, board certified internal medicine and wellness physician. And today I'm going to be talking about one of my favorite and most underrated injections, treatment of the platysma muscle. So the platysmal muscle is one of the most superficial muscles in your neck, and they actually overlap all of the musculature of the lower face. So the platysma is a relatively superficial injection. There are many ways to do this. When you inject the platysma muscle, this is also part of the Nefertiti neck lift that you can perform for patients. And there are actually 3 ways that you can inject the platysma to make an impact in your patient's lower face and reciprocally maybe give them about a ½ centimeter raise in their mid face. So that's one of the reasons that I love this injection. It should always be evaluated when you're doing a depressor angularis oris muscle injection or a mentalis injection. Always evaluate that platysma muscle. Okay, so when you're injecting a platysmal muscle, this is the first way, okay? All right, I always draw a line down from my nasolabial fold to where this intersects the mandible. And this is really where your first injection point of 2 units is going to be. Remember, you want to direct this away from your depressor labii inferioris muscle and other muscles in the lower face of the mouth. So there is your lower face. So here is your first injection point. Then your last injection point is going to be superficially along the posterior aspect of the jaw. And so you know that you need 2 injection points equidistant in between the first and the last so that you can deliver a total of 8 units along the angle of the mandible. And this is going to be beautiful for patients. Okay, so that is the first injection point. Now, if you have your patient grimace and you see platysmal bands, I always tell people if you can't grab them, you can't stab them. Then you pull at the back of your neck and you can actually give two unit injections posteriorly. This alone will give you a lift in the anterior portion of the neck and really gives patients a beautiful relaxation of some of these tech neck lines. So very important. And that is the second way. So the first way is angle of the mandible alone. And often we will combine this with equidistant injection points just inferior to the angle of the mandible. So for injection type number 1, you have 8 units and 8 units, 16 total units on each side for a total of 32 units. Second way, you can do these 4 injections with 2 posterior and superior injections, and that is also beautiful. Third way, you could treat platysmal bands only, and that is you have your patient grimace. There's a band. And so as you see a band, you can have them march out equidistant. These are all 1 unit injections. And again, if you can't grab them, you can't stab them. So remember that for platysmal injections. Typically, it is not recommended to give more than 16 units in the platysma at a time. That is because this leads to neck extension weakness. Patients may report a difficult time doing a sit-up, doing a crunch, and so it's important to note that. But it really does give a beautiful result and relax these lines. The fourth way, which is a bonus way, is for you to treat all of the angle of the mandible superiorly and inferiorly along with platysmal bands. And remember, it's this portion that you don't want more than 16 units in. If you're combining it with the angle of the mandible, typically you're fine. Who are patients that you may not want to do this on? Patients who already have significant jowling. This is going to cause relaxation of the posterior aspect of their jaw and can actually make jowling worse. So it's very important that you counsel your patient on that. But platysma is one of my favorite injections for patients watching. It can be anywhere from, 32 plus 16 or just 32 units or 20, right, for each side. So it really is variable on patient anatomy, what is going to give you the best outcome, and that's why you need to find an expert to treat you.